This video of mine is about thalassemia, which is an inherited blood disorder that causes your body to have less hemoglobin than normal. Hemoglobin enables red blood cells to carry oxygen. Thalassemia can cause anemia, leaving you fatigued. Well, if you have mild thalassemia, you might not need treatment, but more severe forms might require regular blood transfusions. You can take steps to cope with fatigue, such as choosing a healthy diet and exercising regularly. Now I will tell you the symptoms. There are several types of thalassemia. The signs and symptoms you have depend on the type and severity of your condition. Thalassemia signs and symptoms can include fatigue, weakness, pale or yellowish skin, facial bone deformities, slow growth, abdominal swelling, dark urine. Some babies show signs and symptoms of thalassemia at birth, others develop them during the first 2 years of life. Some people who have only one affected hemoglobin gene do not have thalassemia symptoms. Make an appointment with your doctor for an evaluation if he or she has any of the signs or symptoms of thalassemia which I have just told you. Now let me tell you the causes. Thalassemia is caused by mutations in the DNA of cells that make hemoglobin, which is the substance in red blood cells that carries oxygen throughout your body. The mutations associated with thalassemia are passed from parents to children. Hemoglobin molecules are made of chains called alpha and beta chains that can be affected by mutations. In thalassemia, the production of either the alpha or beta chains are reduced, resulting in either alpha thalassemia or beta thalassemia. In alpha thalassemia, the severity of thalassemia you have depends on the number of gene mutations you inherit from your parents. The more mutated genes, the more severe your thalassemia. In beta thalassemia, the severity of thalassemia you have depends on which part of the hemoglobin molecule is affected. Now let me tell you a little bit more about alpha thalassemia. 4 genes are involved in making the alpha hemoglobin chain. You get 2 from each of your parents. If you inherit one mutated gene, you will have no signs or symptoms of thalassemia, but you are a carrier of the disease and can pass it on to your children. 2 mutated genes. Your thalassemia signs and symptoms will be mild. This condition might be called alpha thalassemia trait. 3 mutated genes. Your signs and symptoms will be moderate to severe. Inheriting 4 mutated genes is rare and usually results in stillbirth. Babies born with this condition often die shortly after birth or require lifelong transfusion therapy. In rare cases, a child born with this condition can be treated with transfusions and a stem cell transplant. Now let me tell you some more details about beta thalassemia. 2 genes are involved in making the beta hemoglobin gene. You get 1 from each of your parents. If you inherit 1 mutated gene, you will have mild signs and symptoms. This condition is called thalassemia minor or beta thalassemia. 2 mutated genes. Your signs and symptoms will be moderate to severe. This condition is called thalassemia major or Cooley's anemia. Babies born with 2 defective beta hemoglobin genes usually are healthy at birth but develop signs and symptoms within the first 2 years of life. A milder form called thalassemia intermedia also can result from 2 mutated genes. Now I will tell you the risk factors about thalassemia. Factors that increase your risks of thalassemia include family history of thalassemia. Thalassemia is passed from parents to children through mutated hemoglobin genes, as I told you before. Certain ancestry. Thalassemia occurs most often in African Americans and people of Mediterranean and Southeast Asian descent. Complications. Possible complications of moderate to severe thalassemia include iron overload. People with thalassemia can get too much iron in their bodies either from the disease or from frequent blood transfusions. Too much iron can result in damage to your heart, liver and endocrine system, which includes hormone-producing glands that regulate processes throughout your body. Infections. People with thalassemia have an increased risk of infection. This is especially true if you have had your spleen removed. In case of severe thalassemia, the other complications can occur, which are bone deformities. Thalassemia can make your bone marrow expand, which causes your bones to widen. This can result in abnormal bone structure, especially in your face and skull, as you can see in the images. Okay. Bone marrow expansion also makes bones thin and brittle, which increases the chance of broken bones. Enlarged spleen. The spleen helps your body fight infection and filter unwanted material. such as old or damaged blood cells. Thalassemia is often accompanied by the destruction of a large number of red blood cells. This causes your spleen to enlarge and work harder than normal. And a large spleen can make anemia worse, and it can reduce the life of transfused red blood cells. If your spleen grows too big, your doctor might suggest surgery to remove it. Slowed growth rates. Anemia can both slow a child's growth and delay puberty. Heart problems. Congestive heart failure and abnormal heart rhythms can be associated with severe thalassemia. Now I'll tell you some preventive measures. In most cases, you cannot prevent thalassemia. If you have thalassemia or if you carry a thalassemia gene, consider talking with a genetic counselor for guidance if you want to have children. There is a form of assisted reproduction technology diagnosis which screens an embryo in its early stages for genetic mutations combined with in vitro fertilization. This might help parents who have thalassemia or who are carriers of a defective hemoglobin gene have healthy babies. The procedure involves retrieving mature eggs and fertilizing them with sperm in a dish in a laboratory. The embryos are tested for the defective genes, and only those without genetic defects are implanted into the uterus. Now I will tell you about the diagnosis of thalassemia. Most children with moderate to severe thalassemia show signs and symptoms within first 2 years of life. If your doctor suspects your child has a thalassemia, he or she can confirm a diagnosis with blood tests. Blood tests can reveal the number of red blood cells and abnormalities in size, shape, or color. Blood tests can also be used for DNA analysis to look for mutated genes. Also, we can do prenatal testing. Testing can be done before a baby is born to find out if he or she has thalassemia and determine how severe it might be. Tests used to diagnose thalassemia in fetuses include chorionic villus sampling, usually done around the 11th week of pregnancy. This test involves removing a tiny piece of the placenta for evaluation. Another test which is used in prenatal testing is amniocentesis, which is usually done around the 16th week of pregnancy. This test involves examining a sample of the fluid that surrounds the fetus, and that is called amniotic fluid. Now I will tell you about the treatment. Mild forms of thalassemia do not need treatment. For moderate to severe thalassemia, treatment might include frequent blood transfusions. More severe forms of thalassemia often require frequent blood transfusions, possibly every few weeks. Over time, blood transfusions cause a buildup of iron in your blood, which can damage your heart, liver, and other organs. Chelation therapy. This is a treatment to remove excess iron from your blood. Iron can build up as a result of regular transfusions. Some people with thalassemia who do not have regular transfusions can also develop excess iron. Removing the excess iron is vital for your health. To help rid your body of the extra iron, you might need to take an oral medication such as Defracirox, which comes with the name of Exjade or Jadino, or Defriprone, which comes with the name of Feriprox. Another drug, which is known as defroxamine, which comes with the name of Desferol, is given by needle. Stem cell transplant, also called a bone marrow transplant, which is a stem cell transplant, might be bone marrow transplant is also known as stem cell transplant. This might be an option in some cases. For children with severe thalassemia, it can eliminate the need for lifelong blood transfusions and drugs to control iron overload. This procedure involves receiving infusions of stem cells from a compatible donor, usually a sibling. Now I will tell you some lifestyle and home remedies which you should note down, because these are very important. You can help manage your thalassemia by following your treatment plan and adopting healthy living habits. You should avoid excessive iron unless your doctor recommends it. Do not take vitamins or other supplements that contain iron. Eat a healthy diet. Healthy eating can help you feel better and boost your energy. Your doctor might also recommend a folic acid supplement to help your body make new red blood cells. To keep your bones healthy, make sure your diet contains enough calcium and vitamin D. Ask your doctor what the right amounts are for you and whether you need a supplement. Ask your doctor about taking other supplements as well, such as folic acid. It's a B vitamin that helps build red blood cells. Avoid infections. Wash your hands frequently and avoid sick people. This is especially important if you had your spleen removed. You will also need an annual flu shot as well as vaccines to prevent meningitis, pneumonia, and hepatitis B. If you develop a fever, other signs and symptoms of an infection, you should see your doctor for treatment. Well, this was a video about thalassemia. If you have any questions regarding this illness, you can post your question in the comment section.